Welcome, everyone, to the New York State Office of Mental Health Capacity Monitoring Survey for Motors CCBHC Programs Technical Training. My name is Barbara Brown. I'm with the Office of Population Health and Evaluation. So for today's training agenda, we'll start with an overview of the Capacity Monitoring Survey. Then we'll walk through the MHPD application overview where the survey is located. This part will cover how to obtain access and how to enter the application. Next, we'll cover access to the Capacity Monitoring Survey in MHPD, covering manual data entry with a survey item breakdown. After that, we'll go over the bulk upload entry workflow, and finally close with getting help. Before we get into the system walkthrough, I want to start with a brief overview of the Capacity Monitoring Survey. Many of you may already be familiar with it if you attended one of the information sessions OMH conducted in May, but this overview helps set the training for everything we'll cover today. The purpose of the Capacity Monitoring Survey provides New York State Office of Mental Health with the essential information to monitor service access and changes in provider capacity. All OMH licensed 2100 mental health outpatient treatment and rehabilitative services, MOTRS programs, as well as certified community behavioral health clinics, CCBHCs, are required to complete the survey. Reporting is done at the site level, meaning each main site and every satellite location must submit its own survey. Each physical site or location submits its own monthly capacity data. All sites expected to report will appear in the capacity survey drop-down menu. Now, earlier July, OMH sent an update to all CCBHCs regarding this reporting update. If you did not receive this correspondence or if you need it resent, please contact the MHPD help desk. Now, the capacity survey follows a monthly reporting schedule. Each month's data is due by the 15th of the following month. For example, August data must be submitted by September 15th. After the first submission, reporting continues on a recurring monthly cycle. Each month's deadline is the 15th of the next month, or the next business day if the 15th falls on a weekend or a state holiday. So where is the survey located? The survey is accessed through the Mental Health Provider Data Exchange, MHPD, application. Within MHPD, you can complete the survey either by entering data manually or submitting a batch upload. So a little bit about the application where the survey is located. Some of you may already be familiar with MHPD application, but for those who aren't, MHPD is a web-based application that serves as the master provider directory for New York State's public mental health system. Its purpose is to allow local mental health authorities and providers to submit, verify, and request changes to program information as required by OMH. This is the same application you would use to add a new site or close an existing one. So if you do not see your site listed in the capacity survey dropdown, this is the application you would go to make any changes. There are a couple of other surveys conducted in MHPD that some of you may already be familiar with. The Total Unique Identifier Survey is conducted quarterly, and the Facility Survey is completed each PCS survey year. And now with the addition of the Capacity Monitoring Survey, reporting will take place in this application monthly. User access to MHPD is granted by your facility security manager through the Authorization Management System, AMS. Before you can complete the capacity survey, you'll need to make sure you have the correct permissions. So let's take a look at how to obtain access to MHPD. To access MHPD, users first need an active OMH user ID and password or token issued by their security manager. They also need to be assigned to one of the two MHPD security roles, either the provider admin or provider user. Now note, either role gives the level of access required to complete the capacity monitoring survey. It's just that the provider admin role has broader security rights, such as the ability to open and close programs. Your facility should decide which role is appropriate for each user. Now, these notes below include a clarification how access is granted depending on the user situation. Users who already have an OMH account may still need MHPD permissions added. That update is handled by the facility security manager through AMS. Users without an OMH account will need their security manager to create an account in AMS, issue login credentials, and then assign MHPD access. Now, on the next slide, we'll take a brief look at the security manager's role. Each facility has a designated security manager, and they're responsible for entering user information into AMS. They're also the only person who can grant access to MHPD, so any changes in permissions, whether it's adding MHPD access or creating a new AMS user account, must go through them. If you are unsure who your security manager is, you can check with your facility director. And if you still can't identify the right contact, you can email the MHPD help desk for assistance. And the MHPD help desk email is right here. So now that we've covered what users need for MHPD access, let's walk through how users log into MHPD. But before we start, there are a couple of system requirements to be aware of. Users need to run Microsoft Edge in Internet Explorer compatibility mode. This is the only supported browser configuration, and pop-ups must be enabled for this site. The slide deck includes step-by-step instructions for both settings, but for the sake of time today, we'll move right into the login process. To begin, users should open Microsoft Edge in IE compatibility mode. Once your browser is open, type or copy and paste the MHPD link into the address bar. After entering the link, press Enter, which takes you directly to the MHPD homepage. On the MHPD homepage, where I'm just displaying a portion here for training purposes, to start the application, click on the MHPD restricted link here. Selecting this link launches the MHPD application and brings you to the Statement and Confidentiality screen, which looks like this. A statement of access and confidentiality will pop up. Please read it carefully and then click Agree to continue. Now, once you click Agree, you will then see the login screen where you can enter your OMH user ID and token. Enter your credentials. Be sure to select the correct authentication method, then enter your user ID and 8-digit RSA token code, and click Login. If you experience any issues with your token or logging into MHPD, please contact the MHPD help desk. Again, here's the email. Now, once your credentials are validated, the Salute login screen appears. From there, click on MHPD to open the Verify Contact Information page, which looks like this. Now, on this Verify Contact Information screen, review the displayed information carefully. It contains all your current contact information. This screen appears each time you log into MHPD. It's an internal check to make sure your contact information hasn't changed. Users should take a moment to confirm that everything listed is still accurate before moving into the application. If your contact information is correct, click Yes. If your details are incorrect, click No and contact your security manager to update them. Okay, now that we're fully logged into MHPD and have confirmed our contact information, we can move into the next part of the training, accessing the capacity monitoring survey. Now, this section will show you exactly where it's located inside MHPD and how to navigate to it from the MHPD main menu. So after you click Verify Contact Information, Yes, on that screen, the MHPD dashboard will appear. Now at the top, you'll see a gold menu bar. From that menu, go all the way over to the right and find that surveys link, and you're going to click on that to open up the survey screen. On the surveys page, you'll see a list of available surveys, including the capacity survey, and possibly others like the facility survey or the totally unique individual survey if your facility takes part in them. To open the capacity monitoring survey, click the pencil icon all the way over to the right of the row on the screen. Clicking on that pencil icon displays the screen with your facility name. To open the capacity monitoring survey, again, you're going to go all the way over to the right and click on the pencil icon. This will launch the survey for your facility. Before entering the survey, you'll first see a screen that displays the primary and secondary contacts for your facility. These fields will be pre-populated with contacts provided by your facility from the OMH contact survey. The survey criteria is below the contacts, and the month and year will default to the current reporting month and year. And you will also see a return button, which will take you back to that facility name screen. So let's walk through each one of these sections, the contacts and criteria section. In the contact information section, you'll see your primary and secondary survey contacts for your facility. Below the screen, I provided a brief description of what each role is responsible for. A primary contact serves as the main point of contact during the monthly reporting period, also responsible for ensuring accurate and timely completion of each site survey, and the first person to be contacted for questions or issues related to site data. The secondary contact assumes the role of the primary when the primary contact is unreachable. Now, as mentioned, these contacts were collected earlier from your facilities by OMH, and they will automatically populate each time you log into MHPD. If any of the contact information has changed, you can use the Update Contacts button to make sure the correct individuals are listed for your facility. Now, below the contacts is that survey criteria section. This section includes the survey year and month, both of which will default to the current reporting period. So when you enter the survey next month, the year will be 2026 and the survey month will be August. You will also see 3 buttons in this section. The first button, Get Sites, is used to continue into the survey and display the list of your sites. The other 2 buttons, Download Survey Template buttons and the Browser button, will be covered later in the upload portion of the training. So after you click that Get Sites button, the survey site drop-down menu will appear. This drop-down should display all motors and CCBHC sites expected to report at your facility. If a site is missing or has closed, please be sure to make that update in this MHPD application. Please contact the MHPD help desk for additional assistance. From the drop-down, select the site you want to submit data for, then click the Get Survey button to open the survey. Note, you'll see that there's a Change Month Year button. Clicking this will return you to the survey criteria screen where you can adjust the reporting month and year if needed. So a little bit about survey status. When you start a survey, the survey status will always display as pending. All surveys default to pending when first opened, which means no data has been entered yet and the survey is ready for initial data entry. If you begin entering information and decide to return later, you can click the Save button. Once you save, the status changes from pending to saved, indicating that data has been entered but not submitted to OMH. The final status is submitted. This appears after all required data has been entered and officially submitted to OMH. You'll see this status next to the site name in the drop-down menu. It's important to note that once a survey is in submitted status, no further editing is allowed. If you need to correct something or submit the survey by mistake, please contact the MHPD Help Desk for assistance. Okay, so select the site that you want to submit your data for in this survey site dropdown. Then click the Get Survey button to open the capacity survey for that site. So clicking Get Survey opens the capacity survey for the site you selected from the drop-down menu. This top section of the survey is the survey information area. Here you will see the survey due date, your facility name, and the survey criteria carried over from the previous screen. You will also see the survey status, which shows whether the survey is pending, saved, or submitted, and the last updated by field displays the name of the user who most recently entered information for this site. On the right side of the screen, you'll find Action menu in the floating gold menu box. You have Save, Save, Submit, and Return. Clicking Save stores your data so you can return later. Clicking Save and Submit sends the completed survey to OMH and cannot be edited afterward. This is the final submission. And Return brings you back to the facility name screen. Please note that if you did not click Save after entering your data and then just click Return, you will lose your data. So please be sure to click Save as you enter. And remember, once a survey is in the submitted status, no further changes can be made, and you will need to reach out to MHPD Help Desk for needed edits. Now, below the survey information section, you'll see the survey form. The capacity survey includes 7 questions reported monthly for adults, children, and adolescents. You'll see those breakouts displayed as 0 through 17, 18 plus, and then a totals column. Please note that question 1 does not have an age breakout. It is reported as a single value. Now, when entering data, please follow these rules. Please note that all fields in the survey require a value. Do not leave any fields blank. Blank fields will prevent the survey from saving and will trigger an error. Please be sure to use whole numbers. Decimals will not be accepted and will trigger an error. Use NA when the field does not apply to your site. For example, children are not served at your site. Note, NA must be entered exactly as shown. It is not case sensitive, but the slash is required. Use the value of 0 when the service applies, but there was no activity for the month. For example, children can be served at this site. However, in the reporting month, 0 children happen to be served. This logic applies to both manual and bulk upload data submissions. Again, NA means the field is not applicable, and 0 means the service applies but had no activity during the reporting month. It's important to know these definitions. Okay, now let's take a look at each of the survey questions. The question 1 is presented as a drop-down menu. You'll notice several NA options in the drop-down menu. These are specifically for sites that do not conduct intake assessments, that are school satellites, and New York City programs reporting through New York City MH Connect. If your site falls into one of these categories, select the NA option that corresponds. For all other sites, choose the option that reflects your best estimate of whether you will have availability for referrals. Please note the definition for this question It refers to the calendar days to the first open appointment to schedule a routine intake based on the date you are reporting. Also keep in mind the data sources used for this question, such as scheduling systems or intake logs to ensure your response is accurate. Questions 2 and 3. Question 2 asks for the total number of services provided in the past month. This is defined as the number of billable services provided by your program site in the past month. And question 3, the number of group services provided in the past month. And these fields are include age breakouts of 0-17, 18 plus, and total. Note that the total column automatically sums, the application sums the row based on your entries. Because it is auto-calculated, it cannot be edited. Just enter your values for each group, and the system will generate the total for you. Now, question 4 asks for the number of individuals in treatment as of the end of the month. Please note that number in treatment equals open cases. Pre-admissions are not counted in this question. Only unduplicated open cases should be included. For continuing care, report the number of open cases as of the end of the month. At the bottom of the screen, you'll see the definition for this question. It refers to the number of admitted individuals on the census who have not been discharged. Use this definition in your program's open case records to ensure the number you enter reflects your active treatment population at month's end. Question 5 asks for the number of individuals who received any type of service during the past month. Below is the definition. The number of individuals received any type of service, including pre-admission services with adult and child breakouts. This is an unduplicated count, meaning each person is counted only once, even if they receive multiple services. Be sure to include individuals who received services during the reporting month, but were later discharged. They still count because they were active at some point during the month. Question 6 asks for the number of individuals admitted to the program during the past month. This is also an unduplicated count, so each person is counted only once as a new admission. If an individual was both newly admitted and discharged within the same reporting month, they should be counted twice, once as a new admission in question 6 and once as a discharge for question 7. However, do not count individuals who were discharged from a treatment episode and then admitted to continuing care episode as new admissions. That situation represents a continuation of services at a different level, not a new admission. Use your program's admissions and discharge records to ensure the number reflects true new admissions for the month. And the last question, question 7, asks for the number of individuals discharged from the program during the past month. Note, this is a non-duplicated count, so each person is counted only once as a discharge. Only include individuals who are not admitted, only include individuals who were admitted to the Motors and CCBHC programs and then discharged during the reporting month. If an individual was newly admitted and then discharged within the same month, they should be counted twice, once as a new admission in question 6 and once as a discharge in question 7. Do not include individuals who were never admitted, such as those in pre-admission status who did not move into treatment. Use your program's discharge records to ensure the number reflects all individuals formally discharged during the month. Okay, once you've completed all your entries, take a moment to review your data and make sure no fields are left blank. When you're confident the information is accurate and ready to submit to OMH, you're going to click that Save and Submit link on the right side of the screen. This action is final. After you submit, no further edits are allowed. If the survey is submitted in error or you realize an edit is needed, you'll need to contact the MHPD Help Desk to have it reopened. Here's the email down here. So please be careful before clicking that Save and Submit. Once you do submit, you'll see a confirmation pop up indicating that your survey has been successfully submitted. At this point, you're finished entering your data for this site. Now, once your survey is submitted, you'll see that the survey status changed from pending to submitted for that site. You can view this in the Survey Criteria Site drop-down menu. You'll also see a gold message box in the upper right-hand corner of the page where you can click to begin another survey. You'll return to the survey criteria screen where you can select a different site by clicking on Get Sites to enter additional data. Note year, month, default to currently reporting period. Or you can click on that return link in the box, which will bring you back to the facility screen. From there, you can then log out in the upper right-hand corner by selecting that. At this point, your submission is complete and the survey for that site is fully entered and submitted to OMH. Okay, we've now covered how to enter data manually and reviewed entries and submitted a completed survey. Let's take a look at uploading data. Now, batch bulk upload allows facilities to upload their survey data into the MHPD application using a CSV file template. Facilities with many sites are strongly encouraged to use this feature. However, facilities must be able to follow the application parameters exactly for the upload to work correctly. To get started, navigate to the survey criteria screen, review the year and month. They should default to the current reporting month and year. Make sure they are correct. Then click the Download Survey Template button. This will give you the CSV file to use and prepare your upload. When you click the Download Survey Template button, the system will trigger a download pop-up that looks like this at the bottom of your screen. You'll see the Capacity Survey CSV file appear with a Save option. Click the arrow next to the Save option and then click Save As. This allows you to choose where to store the CSV file before you begin entering your data. Clicking Save As will open the Save As dialog box. Choose your desktop as the save location so the file is easy to find. Then click Save to store the file in that location. It's important not to change the Save As type. The file must remain in CSV format for the upload process to work correctly. So after you click Save, a confirmation pop-up will appear, letting you know the file download is complete. Click the Open button in that pop-up to launch the CSV file. The template will open in your default spreadsheet application, such as Excel. When Excel opens the file, you may see a prompt asking whether to convert the file. Don't convert. Click on that so the file stays in CSV format, which is required for the upload process. Now, when you open the template, do not change any of the values in the first group of columns. There are 7 columns here: facility code, program code, site code, operating certificate number, site name, survey year, and month. These fields are automatically generated by the application based on the selections you made in the survey criteria screen. You should not reorder, rename, or remove any of the column headers. Every cell in the template must contain a value, so do not leave any fields blank. Also, do not use decimals. All numeric values must be entered as whole numbers. Make sure the totals you enter for each row add up correctly. Unlike manual entries, the total columns will not auto-sum in the upload. And you must remember to use NA when the field does not apply to your site. For example, children are not served at your site. Note that the NA must be entered exactly as shown. It is not case sensitive, but that slash is required. Enter 0 when the service applies, but had no activity for the month. Example, children can be served at that site. However, in the reporting month, 0 children happen to be served, as covered in the earlier slides. Make sure when you're finished to save the file to your desktop and keep the Save As type set to CSV. This file must remain in a CSV format for the upload process to work properly. So before you complete the template, please refer to the data dictionary. It provides column labels, question definitions, data types, and discrete variable options you'll need to enter your data correctly. If any value in your spreadsheet falls outside the required data type, you'll receive an error message during the upload. Likewise, if any survey field is left blank, the system will generate an error message. So it's important to check your entries carefully and make sure every value meets the reporting requirements defined by the data dictionary. Copies of the upload template and the data dictionary were sent out with a training announcement. So if you did not receive these documents and would like a copy, please contact our MHPD help desk. Once all fields in the template are complete with no blanks and you reviewed everything for accuracy, now you can upload your file. Save the file to your desktop. After the file is saved, you're ready to upload it. Go back to the survey criteria section and click on that Browse button. This will open a file selection window where you can locate your CSV file you saved to your desktop and prepare it for upload. When you click Browse, a Choose File to Upload pop-up will appear. Locate your completed CSV file on your desktop, then click Open to proceed. After the file is selected, the system will display an Upload Successful message. Click OK to close the confirmation and continue with the next step. So now when you return to the survey criteria screen after successfully uploading your data and open the list of survey sites, you'll see that each site you uploaded data for now has a status of submitted. As long as all your listed sites display with a status of submitted, you have successfully completed the data upload. At this point, no editing is allowed. If you uploaded your file in error or need to make a correction, please contact the help desk for assistance. The email is displayed here. Okay, when you're finished, you can click on the return in the gold menu box. This will bring you back to the main menu where you'll see the log out option all the way to the right of the menu bar. Click on log out to exit the application. Okay, a few things about incomplete submissions. If a site shows a status of pending and saved, it means the required data has not been fully completed or submitted to OMH. In these cases, the designated primary contact for that site will be contacted to complete the missing information and submit the survey. By the 15th of the month, OMH will review all facilities with sites that have these statuses and reach out to the primary designee to request the missing data. All sites must have a status of submitted by the 15th of the month to not be considered delinquent. Site surveys not submitted by the deadline will require MHPD help desk assistance to be reopened. Okay, if at any time you need assistance accessing the MHPD application, completing the capacity survey, or navigating any of its features, support is available. Please email us at mhpd@omh.ny.gov. When you reach out, we ask that you include capacity survey in the subject line to ensure a timely response. Thank you so much for attending this training. Have a great day.